So today we will discuss about your another atypical rib, which is your second rib. Okay. So before starting the class, you have to know some basic things regarding your thoracic cage or ribs. Okay. Because if in exam you are failed to answer this rib or any type of rib, examiner must ask these basic things. Okay. So first, what is thoracic cage? Okay. See here. This is mainly your thoracic cage. Okay. So the thorax is supported by a skeletal framework. So this is your skeletal framework, and this is your mainly the thoracic cage. So it provides attachment to different muscles like back muscles and then thoracic muscles and upper extremity muscles. Okay. And see here, this is your mainly inlet, and this is your outlet. Okay. See. So how this thoracic cage is formed? Anteriorly sternum and the posteriorly, yes, T1 to T12. Okay. And laterally the ribs. So how many ribs are there? 12 pairs along with the costal cartilage. Okay. Next is your intrinsic muscle. Okay. Means the main muscles of your thorax, not only the intercostal space muscle. This is whole thoracic muscles. Okay. So first is your external intercostal, then internal intercostal, then transverse thoracic. This transverse thoracic also divided intercostalis intimus, subcostalis and sternocostalis. Okay. Then next is intercostal spaces. So how many intercostal spaces are there? 11 pairs. Okay. So out of this, third to sixth is your mainly the typical one, because the nerve supply and blood supply are limited to this only the thoracic area only. Okay. And the another are called your atypical intercostal nerve, because they are not only confined the thoracic wall, they are supply also the different your upper limb or lower limb. Okay. Also. Okay. Next, the contents of the typical intercostal space. So this is your typical intercostal space here. First is your external intercostal, then internal intercostal, then innermost intercostal. Then the VAN structure, intercostal vein, arteries and nerves. Okay. Now the classification of the ribs. Okay. So according to the features, they are typical and atypical. So can anyone tell me the features of the typical ribs? Yes. See, curved, angulated and twisted. So what is the meaning of twisting? Yes. Yes. If you put it on the table or any plane surface, the posterior part is lift off. Okay. This is the main reason. But here in the first and second rib, see the anterior end and posterior end and touch your surface. So this do not have this twisted nature. Okay. So first rib also does not have any twisted nature. Okay. So this is your all the typical ribs features. Your typical ribs is third to ninth ribs. Okay. See, the typical ribs is third to 9, and the atypical rib is first, second, 10th, 11th, 12th. And always remember the typical rib having some similar features. But the first, second and 10th, 11th, 12th does not have the similar features. They have some different features. Okay. So next is your, according to the relation of the sternum, the first 7 rib is directly attached to your sternum. So they are mainly your true ribs. Okay. Then 8 to 12 ribs is false rib, because they do not directly attach to your sternum bone. Next is very important classification according to the articulation. Okay. First is vertebro-sternal, means first 7th rib is directly attached to sternum, but the vertebrochondral rib 8 to 10. So they are attached to the sternum but not directly, because the 8, 9, 10 are together attached to the upper costal cartilage, means in the 7 costal cartilage. So the 8, 9 and 10th ribs are not directly attached to your sternum, they are together attached to your 7 costal cartilage. Okay. So see this line, the vertebrocondyle ribs articulates posteriorly with the vertebra, and anteriorly their cartilage join the cartilage of the higher rib, means the seventh rib. Okay, and they are the floating rib, 11 and 12. Always remember these two ribs are more prone to injury because anteriorly they are not attached to the anterior end is free. Okay, but the first and second rib are not easily fractured because here clavicle bone is present. First fracture is your clavicle bone, then your rib cage, means first and 7 ribs. So thoracic cage is mainly this part. The thorax is supported by a skeletal framework. This is called your thoracic cage. It provides attachment to the muscle of thorax, upper extremities, back and diaphragm. Next is formation, means how it is formed. Means this thoracic cage, how it is formed: anteriorly to your sternum, posteriorly the thoracic vertebra, and laterally the 12 pairs of the ribs. Next is your intrinsic muscle of the thoracic wall, means whole the thoracic wall muscles, not only the spacious muscle. Okay, so they are the external intercostal, internal intercostal, then transverse thoracic. So third to sixth spaces are the typical intercostal space. What is the reason? Because the blood and nerve supply to the third and sixth costal spaces is confined to the thorax, means only limited to this part only. That's why that's called mainly the typical. They are the mainly the contents of your typical intercostal space, means the third to sixth intercostal space. So 3 muscles are present: external intercostal, internal intercostal, then innermost intercostal muscles, and your VAN structure are present here. One is your intercostal vein, then intercostal arteries and intercostal nerves. Okay, now the classification of the ribs according to the features. They are typical and atypical. Typical ribs having same general features like curved, angulated and twisted, whereas the atypical one have some different features. So this classification is very much important. Examiner must ask this classification. Okay, according to your articulation. First one is your vertebrosternal, because the posteriorly it is attached to the your vertebra and anteriorly with the sternum directly. And another is vertebrocondyle ribs, your 8th and 9th rib. They are together attached to your 7 costal cartilage. Okay, and posteriorly they are attached to your vertebra. And the floating ribs are 11th and 12th ribs. The anterior end is free, and the posteriorly they are attached to your vertebra. So these 2 ribs are more prone to injury. Okay, this 11th and 12th ribs. Now listen properly. Okay, so this is your second rib. Okay, so how you know this is your second rib or not? Okay, the second rib have some means special features. Okay, like this is your second rib, this is your anterior end, and this is your posterior end. Posterior end having head, constricting net, and then tubercle and angle. Okay, here always remember, in case of the second rib, the angle is close to the tubercle. Okay, in case of typical rib, they are 5 centimeter away from this tubercle. Okay, so this is one peculiarities of your second rib. The angle is quite closer to your tubercle. Okay, another is this is your outer surface. Okay, this is your inner surface. Okay, the outer surface having one, see here, one rough area. Okay, this is very important for this second rib. So this is another peculiarities. Okay, so first is the tubercle is close to the angle, and the upper surface or outer surface having one tubercle or rough area, and see the inner surface is smooth. Okay, so outer surface is rough, one rough area also present, and the inner surface is smooth. In the inner surface posteriorly you see one groove present. Okay, this is your costal groove. So by this groove your intercostal and nerve and pass through this. Okay, so this is your anterior end, posterior end. Posterior end having head, neck, tubercle and angle. Angle is close to your tubercle, and this is your outer surface. In the outer surface you see one rough area is present. Okay, and your inner surface is smooth, and the posterior to the inner surface subcostal groove is present by which intercostal vein, artery and nerve pass. Now see, so how you know this is your right side or left side? See, this is present in the same line. Okay, if you put it on the table, you see this is present in the same line and they are touched to the ground. Okay, but in case of the typical rib, they are twisted, so they are not touched to the ground, they are like this only. Okay, so here see, first if you want you can write it down also. Okay, so the second rib is flat. Okay, and the size of the second rib is twice, means by length the size is twice to your first rib. Okay, you see the first rib is quite thicker and the second rib is thinner, so the second rib is thin as compared to your first rib, and the length is twice as compared to your first rib. Okay, and they are highly curved. See, the second rib when placed on the flat surface, the entire rib is touches the surface. Okay, see, the entire ribs is touched the surface. Okay, now the anatomical position. Okay, see here properly, the external surface is directed outward and upward, and the near the middle one rough area is present, prominent rough area. See properly here, this is your prominent rough area. This is present only your upper surface or outer surface. Okay, and the inner surface is smooth and this is directed medially and inward. Okay, and the posterior to the inner surface you see one groove is present. Okay, so this is your left side. How you know this is your left side or right side? See, the outer surface is one ridge like structure or tubercle or the rough area is present. Okay, if you put it on table, you see this is, yes, the smooth surface is upper here, so this is wrong. Okay, smooth surface means inner surface is always inside downward, and see here costal groove also present here. So if you hold it like this, this is wrong. Okay, and this is your anterior end, this is your posterior end. So this is attached to your anteriorly the second thoracic cartilage, by which this is attached to your sternum. Okay, and posteriorly this is attached to your yes T1 and T2, because this having two facets, upper and lower. So by which this is attached to your thoracic vertebrae, T1 and T2. See, this is your head and this is your constricted neck, and this is the tubercle, and the angle is closer to the tubercle, and this is your rough area. Okay, this is the main identifying features of your second rib. Okay, the next, this is your anterior end, and this is your mainly, this is outer border and this is the upper border. Okay, so now the features. So the second rib is by length double as compared to your first rib, and the second rib is quite thinner as compared to your first rib, because the first rib is flat and quite thick. Okay, and the twist is absent in the shaft. Okay, this is your mainly the shaft, and the twist is absent, and external surface is faces, this is the external surface, outward and upward, and the inner surface is smooth, curved and downward, inward. Okay, now see the muscle attachment. Okay, so in the outer surface, middle of the outer surface, one rough area is present. Here the serratus anterior muscles is attached. The remaining part, that is the lower part of the first digitation of the serratus anterior. Can anyone know how many digitations are present in the serratus anterior? Yes, 8 digitations are present. Okay, so first one is attached to your first rib. Okay, only the upper part. Okay, so here the lower half of the first digitation and the entire second digitation is attached to this rough area. So serratus anterior attach this rough area, first digitation of lower half and the entire second digitation are attached here. Okay, so see here, below this tubercle, see one ridge is present, ridge like structure present here. Okay, so anteriorly there are attachment of the scalenus posterior muscle. Okay, these are mainly your neck muscle, scalenus anterior, medial, posterior. Okay, so scalenus posterior muscles is attached here, and below it the serratus posterior superior muscles is attached. This is your back muscle mainly. Serratus posterior superior, serratus posterior inferior. Okay, so here serratus posterior superior muscles is attached. See here, this is your mainly this part, the rough area, which is present middle of your outer surface. So here serratus anterior muscles first and second digitation are present. Okay, lower half of first and entire second digitation are attached here, and this is your this ridge area here anteriorly attached the scalenus posterior muscle and posteriorly attached to the serratus posterior superior muscle. Okay, see the attachment. The outer surface of the prominent tubercle gives attachment to lower half of the first digitation and entire the second digitation of your serratus anterior muscle, and the rough area or prominent area behind it one ridge is present here, anteriorly scalenus posterior muscle and posteriorly serratus posterior superior muscle is attached. So only three muscles are attached here. Okay, now the relation, the inner surface is close to your which organ? Lungs. Okay, lungs and the covering of the lungs, the pleura. Okay, now the articulations. See, in the posteriorly head, neck and the tubercle is present. In the tubercle you see two parts is present. One is your articulation part and another is non-articulation part. Okay, the articulation part is present medially and the non-articulation part is present laterally. Okay, so this is attached to your costal facet of the transverse process of the second thoracic vertebra. When you have the class, these things you better understand. Okay, now only see here, they have in the tubercle have two articulation part. Two part. One is your articulation, another is non-articulation. Okay, so the articulation is part present medially and non-articulation part is present laterally. So the medial part is attached to your costal facet of the transverse process of second thoracic vertebra, and the non-articulation part is present tip of the transverse process of the second thoracic vertebra. Now see, this is your head, means this bony head. So here two facets are present. One is upper facet and lower facet. So these two facets is your articulates with your first and second thoracic vertebra and form costovertebral joint. Okay, and the anterior end is articulation to the second costal cartilage and from costochondral joint. Okay, here three articulation point. Okay, one is your anterior end, another is head and another is tubercle. In the tubercle, articulation and non-articulation 2 points are present, by which this is your articulate with your thoracic vertebra. Now the function, what is the function of your rib cage? So the rib cage protects your heart and lungs and expand with the lungs when you breathe. Okay, so that's all about today's class. Okay.